Welcome, Mount Horeb families. My name is Brian Johnson. I'm the Director of Student Services for the Mount Horeb Area School District. I'm also a co-facilitator for the Mount Horeb Mental Health and Wellness Coalition. Today for this presentation, we have Nancy Pierce with us to do a presentation on how to respond to youth mental health crises during the corona crisis. And so today's presentation is really about if your child or yourself are in a mental health crisis during this time, what should you do? What are the steps to follow, and what can you do now that things are closed and things are a little bit different? We're really lucky to have Mount Horeb resident Nancy Pierce with us. She is a trauma specialist, and she also works for a crisis care unit at Journey Mental Health. So she really has a great wealth of knowledge that we're really lucky to have. So thanks for being with us today, Nancy.
Thank you, Brian. And I want to thank you all for joining this presentation. This is an important topic during this time of the coronavirus crisis, where resources are not going to be available face-to-face, hospital, in the way that they usually are, not only for kind of regular sessions, but more importantly, if your child is in a mental health crisis, there's clearly things you need to know as to what to do, when to do it, where to call. We want you to be prepared so you have a better sense and not feel anxious and fearful about the fact that you don't know how to respond if your child is moving towards a mental health crisis. We know that the pandemic may put some youth at greater risk. I think we have to accept that. Not all. We wish children would be able to rise to the occasion and kind of ride it out, but we do know that this can be difficult for some youth, especially youth that are struggling, that are more predisposed or fragile. So we want you to consider and perhaps really pay attention, notice, that's that awareness, signs, things you see on the outside of a developing mental disorder. The pandemic, the coronavirus, brings understandable stress and distress, which can lead to dysfunction. And we hope at one of these points, you'll notice something is going on with your child. We want you to be aware, not only if your child is developing a mental disorder, but also if they're moving towards a mental health crisis or is in crisis and needing immediate intervention. We want you to know what to do if your child's in crisis. So often parents ask, how can I tell? And they're right. Youth mental illness signs and symptoms often go un- or underreported because initially they look kind of the same. But the way you can tell is that the kind of signs, things you see on the outside, or symptoms, things that are felt internally, but your child can report it to you, these are lasting longer and they're getting worse. So you're going to see that inevitable interference with functioning. Ask yourself, has my child had prior episodes? Have they had a history of some type of mental illness or disorder, or is this the first? Sometimes it's useful to think about your family history of mental illness and whether or not that may give you some clues as to whether or not your child may be at increased risk. Certainly substance misuse or withdrawing from substances can put a child at greater risk. But what we do know is the COVID crisis is understandably increasing fear, a sense of isolation, a loss of connection, routine, outlets, and supports. Protective factors help. Protective factors are those things that reduce risk. They don't eliminate it, but they can help. But if you look at this list, you'll see that the ones that are underlined, feeling control in life, consistent home, family, and school routine, And having that connection with school, with that one adult or adults, or people in the community, those are all not happening given the safer at home guidelines that we're following. And so we need to recognize that those protective factors may not be working as well as we would hope because of the coronavirus. The first mental illness I'm going to talk about is major depression. This isn't just a depressed mood. This is one that your child is going to be depressed almost every day, if not every other day, with lots of different changes in their functioning, whether it's sleep or appetite or mood, whether it's focus or concentration. And what we're seeing when they're moving towards a crisis, when they're either having first-time depression or their depression is getting worse, is that these are getting, that we're going to see them getting even, they're worsening and they're lasting longer. And you may see it in their mood. They look sad, they look depressed, or they may look angry, which sometimes often is what teenagers look like when they're depressed. Their energy is down as well as their motivation, and their sleep can be interfered with. Sometimes you'll see a change in sleep with they're sleeping too much or their appetite changes. So you're seeing a general drop in functioning. Your child may look pretty shut down, disengaged, kind of flat. They may be withdrawing more, isolating more in their room or in your home. They may be coping by using drugs or alcohol, or even engaging in risk-taking behaviors. But the thing we want you to pay attention to the most is the risk of suicide that has a strong association with major depression. Because many people who die by suicide are struggling with depression that may or may not even be diagnosed. So if your child is talking about it, sort of kind of banter, joking about it, being dead, better off dead, no longer being around, believing no way out, even though they're saying it casually, please use that opportunity to ask them, not in a challenging way, but in a curious way, an interested way, a non-judgmental way. And you can even use their words. When you say you'd be better off dead, or you're wondering what it would be like if you were no longer around, use their words and say, what do you mean by that? And if they don't answer you, you might even say things like, sometimes when people are feeling really down, they make statements about not wanting to be around any longer, and they're thinking about ending their life or killing themselves. Is that happening to you? Using their words is a really good way to kind of start the conversation, because it kind of isn't, you're not making assumptions, you're just kind of repeating back what they just said and showing interest, being present, and not being judgmental. Teens often romanticize about death. They wonder how others would react if they're dead. They picture their funeral. Will people love them more, admire them more, or have regrets about how they treated them? If your child is more expressing their thoughts through writing, artwork, music making, poetry, anything that have themes around death or dying or suicide, pay attention to that. And certainly if they're giving away their possessions, if they're saying their goodbyes or thanks, you were my best friend, you were really good to me, please ask them about what that means if they're thinking about ending their life. These are these opportunities. These are the things that we can notice and pay attention to. That's that awareness that we want you to consider, especially during this time of the corona crisis. When somebody is moving towards a depression crisis, that's when their suicide risk is increased. People die by suicide to end unbearable pain and suffering or to solve unsolvable problems. So please understand that when somebody's moving towards a depression crisis, they may be thinking about ending their pain and suffering through death. They're exhausted. They're either losing hope or they've lost hope and control. And they're unable or unwilling to go on when they see no end in sight. It feels like it will never end. And I think with teenagers particularly, developmentally, they will not have kind of the skills to recognize how I feel now is the way I'll always feel is usually not the case. But with teenagers, that's how they feel, as well as believing their feelings are the same as facts, that they're the truth. And sometimes this kind of, sort of the thoughts about ending your life kind of masquerades as the truth, when in fact, feelings are not facts, and feelings change all the time. So the idea that they'll always feel this way, of course, we know as adults may not be the case, but for teenagers, that's how they're viewing the world. That is understandable given their age. If your child is presenting with suicide risk, we need to assess it, whether it's by phone or by telehealth, to determine are they safe at home or in the community, or do they need the safe structure of a hospital. We can do this. We have been doing it for many years by phone, and certainly now we can do it with telehealth. And we also need to consider whether or not we can work with you as parents or family to create a safety plan that will help us to monitor, to manage risk in the home. The next disorder is bipolar disorder, commonly known as manic depression. I think the bipolar illness for younger, like still school-age children would be unusual, but it still is, I think there are still children that are living with bipolar illness being treated for it. So I wanted to cover it because it really carries significant risk. Sometimes people think even more than depression. Bipolar disorder is characterized by, you can have this very happy, giddy, sort of odd mood behaviors, which is called mania. Or the person can be very, very depressed. It's that mood, that depressed mood, that is of concern, because it carries a real risk for suicide. Or you can have both. You can cycle both between the two, mania and depression. What you'll notice is that your child often will be looking pretty angry. Their speech might be very rapid and pressured. You'll see racing thoughts through when they talk. There's this kind of absolute ideas that just tumble out like a flood, and they sometimes go from topic to topic. They frequently have delusions, false, fixed beliefs that they would be considered grandiose. That means they believe they're invincible or they have special powers. Frequently, they don't sleep, they don't eat. Often it's accompanied by substance misuse. And when somebody, especially when they're manic, get engaged in risk-taking, escalated behaviors. A perfect example would be, it might be difficult if someone were manic. They believe they're so invincible they couldn't catch the coronavirus, and so they don't follow self-protection COVID guidelines. But other things that they might think about in terms of fixing a roof, especially if they're using substances, is something that they can easily do, or taking on sort of different tasks that would put them at significant risk. So we want to pay attention to youth that are either developing symptoms of bipolar or are moving towards a bipolar crisis. The three things I want you to remember about youth bipolar crisis is that people can become acutely psychotic from mania. That means the mania is so severe that the youth will become very, very ill. And they will start to have symptoms of psychosis that are very much like you would see a person who is having symptoms from psychosis from another major mental illness. This requires evaluation by phone or by telehealth. We need to determine what the symptoms are, if medication can be helpful. We also need to determine whether or not a safety plan should be created so we can monitor their unpredictable, their impulsive behaviors that may result from their reckless risk-taking. And we would use hospital only if if we feel that the youth cannot be safely kept at home. The second possible crisis could be a crisis of risk. And the youth is so depressed that they become acutely suicidal. Again, that risk needs to be assessed and a safety plan needs to be considered. The third possibility for crisis is the youth often is manic and they're very aggressive and violent, or engaging in significant risk-taking. Again, the same principle applies, that we need to assess their violence, their risk-taking via phone or telehealth, and see if a safety plan can be put in place with monitoring by parents and family. Anxiety disorders are the most common disorder, and the one that likely would be quite prevalent with younger children. I've listed all the different anxiety disorders: social anxiety, generalized anxiety, traumatic stress is an anxiety disorder, obsessive compulsive is an anxiety disorder, as well as panic attacks, panic disorder. So understandably, we're all feeling anxious and fearful. That is perfectly reasonable to consider given the circumstances. But anxiety can become a disorder when it interferes with our everyday functioning, because these unreasonable, irrational, and excessive beliefs come up, often unwanted or uncontrollable. Often it co-occurs with depression, so we have to pay attention to whether or not suicide could be a risk if this child is very depressed as well as anxious. And the kinds of things that often would give us joy and pleasure, sometimes an anxious child is unable to engage in. So when they're at home and they're struggling, the very things that they might be able to use to distract may not be something they're able to do. What we do worry about is when people are having anxiety or panic attacks, they're getting worse, they're getting more frequent. Obsessive compulsive disorder, that sometimes is very, very difficult, very anxiety provoking, and sometimes can result in self-injuring behaviors and traumatic stress. We do know that the COVID crisis may worsen anxiety, given the threat of the illness, the loss of control in your life and the routines, and the fact that you don't have that sort of face-to-face support in your school. Anxiety can become a crisis of risk when the child is feeling so desperate, feeling trapped, there's no way out, and they're feeling like they're truly losing or have lost control when they're having panic attacks. I think that's the most concerning part about anxiety, because we actually worry more about when somebody is feeling desperate and trapped than we do when they're feeling sad. Because when you're feeling desperate, when you're feeling trapped, then this tremendous need to do something, and it has to happen now, is why we are quite concerned about children then impulsively, killing themselves. We certainly know that anxiety interferes with coping and problem solving. Often teens and youth self-medicate with substances, drugs, or alcohol. We know that they engage in self-injuring behaviors. So it's always helpful to ask especially if the self-injuring behaviors are increasing, ask yourself, ask your child, is it helping? Is it calming you down? Because if it isn't working, then they are usually going to be worsen and become more frequent. So we do want to pay attention to self-injuring behaviors, and when your child is physically escalated and agitated. That's when we get concerned about risk. So determine whether it's through your observations or consulting if the risk of suicide is present. I think the rule of thumb is that we want to kind of take care of our own nervous system. We don't want to appear anxious, and therefore because we could then reinforce the very fear that we're trying to help our children not have. We do want to try as parents to avoid judgment or dismissing feelings. That generally doesn't help, because a child then it feels like they're being seen as being silly or dramatic or wanting attention. There are many online instructional videos that can help you and your child when they're experiencing an anxiety or a panic attack that might be very useful during this time when face-to-face meetings or sessions with counselors are not available. And your child, and you can certainly join them, can practice focused breathing, other relaxation. But by all means, do use the telehealth services or phone support to monitor and to help your child manage anxiety and panic. So I do want you to consult, if your child has a provider, to determine if risk of suicide is present, but also they can provide you with support on how you can help your child manage their anxiety. So as I said before, you can help your child with anxiety, whether they have an anxiety disorder or not. I think these are very nice kind of rule of thumb sort of steps, very simple steps to take. Really, the managing your own nervous system is important, because when our nervous systems are activated with fear and anxiety, guess what? It sounds out, we're able to kind of send out a warning to our children, and their nervous systems get activated. So we really want to talk with our children and appear that, whether you feel it or not, that at least you're going to appear is that you are in control, you're calm, and you're going to be able to get through this, and you're going to help them. Be honest, but not alarmist. Share what's happening. Use the KISS approach, which means keep it short and simple. Allow time for questions, and teach your children what they can do. Allow them to take actions like hand washing, or make connections to what they are doing is helping them and others. And then reassure them. I think this is a really important one, that the grown-ups are on this thing. Allow your children to outsource their worries to you. Explain to them, we have the best scientists, the best doctors. We're on top of this. We're going to get through this. We're going to be able to figure out what to do next. It may take some time, but we're going to be able to take care of the situation and keep you safe. And then reduce anxiety. It's good to get outside, fresh air, move about. Good distraction, good for your mental health, good for your nervous system. First episode psychosis is important because I think that sometimes we're not prepared for or aware that our child may be developing symptoms of psychosis. There's often a very long period of time when children might be experiencing symptoms or diagnosable symptoms that can go for months or even years. So it's possible that you may not know your child is developing very subtle signs and symptoms, but with the stress of the corona crisis, that might actually be enough of a stressor that can actually precipitate or trigger some psychotic symptoms. Now, psychosis is a mental state where there's a loss of contact with reality. That means it's difficult telling what is real and what is not. That's a hard concept for us to understand, but imagine not being able to determine what's reality and what's not. That's almost an impossible thing for us to even imagine, and you can see how frightening it might be. Causes can come from depression, it can come from bipolar disorder, come from schizophrenia, substance use, brain injury or illness, seizure disorder, but it also can come from extreme stress. And so that's why we want to pay attention to first episode psychosis for children, because the onset happens during their teenage years. That's when it frequently occurs. You see these early changes, kind of odd behaviors, something just doesn't feel quite right. Your child seems more withdrawn, they're having trouble with concentration, focus, social interactions, difficulties at school, decline in grades. Their functioning, their overall functioning, activity, self-care seems to be dropping. Early warning signs of psychosis, which are very important to report when they're new, when they're worsening. You see that they're having even more trouble or new trouble with thinking clearly. They're not making sense. Their speech sounds disorganized or confused. They're not sort of linking their words together in a kind of a coherent fashion. You notice there's a drop in functioning. There might even be a decline in self-care, personal hygiene. Sometimes there's increased suspiciousness or uneasiness with others. Often that's based on those fixed false beliefs of delusion that people might be out to hurt them or get them. Sometimes they're spending more time, more isolative, secretive, withdrawing, or greater sensitivity to sights and sounds, sometimes hearing a noise and mistaking it as a voice. And sometimes they'll talk about these very odd, but overly intense ideas, beliefs, or feelings. Do remember when they are new, never seen this before, or when they're getting worse, please report this, whether it's to a provider, a primary care provider, your PA, your nurse practitioner, to someone who can be a provider and help you to navigate the services for your child. Crisis of psychosis is the acute symptoms. Remember, this child may look or sound disorganized, confused, not making sense. That's frightening to you, people in your home, in your family, frightening to the child. Sometimes you can notice they're observing them laughing, talking to themselves, or talking to others who are not there. They can be very angry, raging about people, plots to hurt them, their family, or suspicious of friends or family members. So there's these kind of bizarre thoughts that aren't making good sense to you, but that is a symptom of a psychosis. And you'll see a real disruption in functioning, sleep or appetite. And so you'll see more escalated erratic behavior, which is sometimes very difficult to predict. It is essential you contact a provider or a primary care provider. If your child has no providers or you're not sure what to do, please call the crisis line. That line will be listed at the end of the presentation. That's when you need to tell them what's going on, to consult or do a tele-assessment with your provider. If your child's at immediate risk, meaning you're worried your child is not safe or other people in your home are not safe, that is a 911 call. Substance use carries some real risk. I think suicide and overdose risk are the biggest ones because substance use increases risk for suicide. We have learned that when you're using, when you're drunk, when you're high, you're much more impulsive, you're much less inhibited. That means the very things that kind of hold you to this earth are now much, much less, and you're much more disorganized in terms of trying to even sort of plan. So let's say if you're planning a rescue, even if you're thinking about suicide, when you're using, sometimes you completely miscalculate and die, even though you were hoping to be rescued. Children, adults, people that use struggle with blackouts, no memory of their actions, their mood becomes depressed, their self-esteem is dropping, their sleep, even though they think it helps them to sleep, actually there's a tremendous sleep interference. And the very people who you hope will support you, your family, obviously are very unhappy when you're using. Impaired judgment is a big one. So imagine you are using, your judgment's impaired, and you are taking either risks, driving or operating machinery or anything that would put you at risk, or considering ending your life. So you're actually making the biggest decision in your life when your judgment's so impaired from substance misuse. A substance use crisis usually involves risk of suicide. So sometimes people are using in a way to kind of embolden themselves. They would be too frightened to kill themselves, but when they're drunk or high, but more using alcohol, interesting enough, that's more implicated than drugs, there's a greater risk for suicide. There can be a medical crisis from drug or alcohol poisoning. Your child may have taken some unknown pills, opioids, pain medications, tranquilizers. That can cause a life threat by reducing their ability to breathe, it becomes in respiratory distress. Using and driving, other risk-taking behaviors when their judgment's impaired. Clearly, when your child's using, and if they're out of control and they're putting themselves or others at risk, refusing all your interventions, you need to call, whether you have a provider, a primary care provider, a local crisis line if they're not connected. If that child's at immediate risk and cannot be safely managed at home, you need to call 911. So we have covered the kind of the typical, not all mental illnesses and disorders, but the ones that carry some significant risk, especially around suicide or violence or risk-taking behaviors. So now we're going to talk a little more detail about if your child is in a mental health crisis, what can you do? So if I were going to define a youth mental health crisis, it's when you need help quickly, like right away. Your child can't calm down and you cannot calm them down. Your child is uncontrollable and you cannot control them. And your child is at sudden and immediate risk of harming themselves or others. And everything, all your energies are demanded to care for your child. And safety is first, foremost issue for your child and others. A youth mental health crisis is when there's an immediate need for action or intervention. So ask yourself the following question. Do you feel your child's in immediate danger to themselves or others? Can you handle the situation yourself, or do you need help? If you need help, what type of help do you need and from whom? Usually, youth mental health crises involves suicide threats, acts or attempts. When your child is so escalated, they're aggressive and threatening and losing or have lost control. Sometimes it's associated with acute psychotic symptoms and signs, which are out of control, highly unpredictable, and are frightening you and your child and other people in your home. Ask yourself, is there access to lethal means in your home? Do you need the police to come to your home to restore safety and control? Whatever you decide, please stay with your child until things are back under safe control. So, how to get help? What is help? Well, if your child or others are at immediate danger, getting help means calling 911. When you call 911, you're getting a dispatcher not a police officer, and they're going to send the police to your home. You can ask the dispatcher if it's possible, because we're talking, I think, for the Mount Horeb Area School District, it's going to either be Mount Horeb Police or Dane County Sheriff. And you can ask if officers trained in mental health response could be sent to your call. They may not have anybody on duty, but they may. Some officers have greater training and are more skilled in responding to youth mental health crises. Please recognize that when the police come to your home, they're there to restore safety and control. They're not wanting to arrest anybody. There is no crime. They're there doing community policing, and they want to help. But also recognize when they enter your home, they're in charge, and they will control what happens next, including decisions on where your child might be taken or what actions are done. The great thing about Dane County is that there is a very good arrangement that the police, all police departments in Dane County, consult regularly with the local crisis unit at Journey Mental Health Center. And so you can call the crisis line because they are likely going to be the ones that the police will consult with. Tell them your child is having a mental health crisis. Give them as many details about what is happening and any relevant background information. And then make sure that the police and the crisis unit are talking to one another about what is happening with your child. Often people worry and wonder, should I ask my child if I'm worried that they're thinking about suicide? And all our research shows that asking and talking about suicide reduces risk of suicide because it shows you care. It shows that you can help. That's what your child needs to hear. They want you to be present. They want you to help. Many people worry, well, if I bring it up, will I plant the idea? Will I give them ideas of how to do it? Or will I push them over the edge? And the answer is none of those things are true. It will, in fact, if you don't ask, that often that may increase risk. Tell your child, give them some specifics, concrete examples of what you have observed that's worrying you. And then be that patient listener who is going to be hearing them, being patient, being non-judgmental, and using empathy, really trying to kind of see what they're going through kind of out their window. Let them know that you love them and want to help. Ask them as calmly and directly as possible, are they thinking about killing themselves? And unless they answer the very strong no, it is fine to ask them what they've thought about, how they might do this, if they have a plan, because that gives us more information about when it starts, when children or youth are having specifics of what they might do, where they might do it, when they might do it. That shows that they're really been thinking about it and they have developed some strong intent to carry it out versus just having thoughts of suicide. By calling 911, you are making sure that you are helping your child by restoring safety and order, or calling a local crisis center who can help guide you and support your efforts. So I think it's important to let your child know they're not alone. Be present, be patient, don't panic. You're there for them no matter what. Reassure them many young people have suicidal thoughts but don't act on them. That's an important thing to let your child know, because often they worry and they're terribly fearful. If I have them, that means I'll do it. And the answer is not necessarily. And in fact, it helps for you to say, people do have thoughts, but they don't have to act on them. I can help you not act on them. Try not to discount their feelings or convince them they shouldn't feel this way. Let them know you want to help, and you'll get them connected to the services they need. You may be the protective factor that lowers your child's risk in a suicidal crisis. So, how can you reduce risk in your home setting? Well, if your child's moving towards any type of mental health crisis, but especially one that involves risk, please remove firearms from your home and your property. Lock up your over-the-counter meds and your prescribed medications. Don't keep lethal doses in your home, and keep very small quantities of liquor and beer, because 1/3 of suicide victims do use alcohol just prior to their death. So we want to make sure your child has no access to lethal means. Remove things like poison, other lethal means if your child's at risk for suicide, and monitor use of vehicles during the suicidal crisis. It's important to go over and learn what those warning signs are. I have to do something right now of a suicidal crisis. If your child convinces you they're not at immediate risk, yes, they've had thoughts of killing themselves, but they would never do it, or they never even got past the point of thinking about it, and you feel the same way, be sure to contact your provider for phone or telehealth risk assessment and what next steps you should take. So even though they say that they're not going to act on it, something's up. Something needs to, your child is struggling with something that they're thinking about it. If you're unsure what to do or need more of a guide, call you that 24/7 crisis line at Journey Mental Health Center, which is here in Dane County, or you can call the National Suicide Prevention Lifeline, or you can use the crisis text line. The text line is now becoming one of the most popular ways for young people to get help. And then make sure your child knows all these numbers and have them visibly displayed in their home. Safety planning, what I've talked about before, is a big part of what will work well during this corona crisis. This is not new. We have been doing it for many, many years. It's considered good clinical care and practice. Often it's done with providers when hospital is not an option. So in this case, safety planning can be done if hospitalization is not an option and face-to-face contacts are not available. So safety planning, I think, is a very good thing to do, because that will help you as families maximize safety and reduce risk. I think it's important we do it collaboratively. That means that provider should be working with you, the family, the parents, together to learn and identify who's available, if they're able to provide and carry out a safety plan, what things they need to learn, the how-tos of safety planning. Let's talk about it so we can fully understand, everybody's on the same page, and then to implement, carry it out. And then don't just carry it out, then see if it's working and modify it if it needs some changes. I think that when we talk about virtual safety plans, you are going to be creating ones that have virtual activities. But I think you start by first identifying what are those warning signs that a suicidal crisis is developing and a safety plan needs to be used. Articulate those, list those, and then identify your child, you and your child together along with your provider, identify those internal coping skills, the things that kind of internal resources they have on the inside in their brains, their bodies, that can help them to distract from suicidal thoughts. That's what's going to help de-escalate the crisis, because that will also, we can do these virtual safety plans because that, taking into account, we have limited access to resources at this time. So we're going to identify what are the social contacts that will help to distract from crisis, the virtual activities, and I have a whole bunch of things that are listed that are online kinds of things. or virtual hangouts with friends via Skype, FaceTime, Zoom, to watch movies, play board games, online support groups, all kinds of things, as well as even communicating with their current social environment, who is in your home, and your child can actually communicate even virtually, or online with them, with people and within your family themselves, when they don't want to be sitting down and talking with you. Identify who are the social supports who can help your child during this suicidal crisis, who's currently available, and then together with your child determine who is the best source of support. Who are they going to likely feel most comfortable turning to? And then seek permission to contact one or two key people. They're going to be providing the support. So you want to make sure they're willing to do so, and you might provide them some tips on how to help during a suicidal crisis. This is pretty important because it takes time now, but it really saves a lot of time later. So make sure you do identify who are your best social supports who can help your child during this crisis. And you can reduce risk by using the safety plans. You're going to identify those available professional emergency contacts, the ones I just went over with you, of the different both local and national and text line information. But also plan to reduce access to lethal means. Please remember, any firearms, access to firearms will increase risk. You must store them safely or remove them. Decrease access to lethal medication means, like lots of Tylenol, which is considered quite lethal, other medications. And I think that we need to make sure that there's someone with whom that youth is living with who can help secure, make sure they're not available lethal means. So if it's not you, if they're living with someone else, make sure that person is securing any lethal means that might be in that house. And then always review, revise the safety plan, which might need updating as things change. So these safety plans need to be regularly revisited. I think it's important to be specific when you're listing those adaptive options. As an example, talking to a good friend privately versus exposing themselves to more general social media, which might be upsetting, is worth discussing with your child. And remember, virtual contact will feel different or mean different things to your child. So what are the things, the remote contacts, that best suit your child's emotional needs? Ask your child, because some would prefer phone calls or texts when they're feeling upset, but video chats are good for when they're distracted. I think sometimes children need to kind of almost be thoughtful, worth discussing, so that they make good choices about different options when it comes to virtualizing a safety plan. A quick word on psychiatric hospitalization. We know that hospitals are not as available, but we also know that there might be situations that your child might need a hospital if a risk of safety is so great and that cannot be managed within the home. So hospitalization is used, it's usually fairly brief when a youth is at immediate risk for self or to others, or when they are psychotic for the first time or they're having a very early relapse. The reason why first episode psychosis is in there is because we can rapidly use medications, but that child needs to be in an inpatient setting. That is very difficult to rapidly use psychiatric medications when they're in the home. And sometimes when a child is having a first episode of psychosis, they will refuse 2 medications and they will be highly symptomatic. So they may need the safety of an inpatient setting. Psychiatric hospitalization is used when there's significant risk-taking behaviors, even if it's not suicide, when there's serious medical issues, when there's substance use issues. So call your healthcare provider, learn what they're needing to know what they're requiring before admission is considered. And basically, please don't go to the hospital before consulting your provider or crisis unit if your child is not connected with services. Tips for when talking with a provider is that you may be very well having to talk with your provider. So I want you to write down questions, concerns beforehand so you feel prepared. Bring a family member to support you. Tell the provider what's most important to you. Answer their questions honestly. This is a really important time for you to be pretty straightforward about what you're needing. And then ask. If you need explanations, more information, including pros and cons or recommendations, ask for them. Speak up about your concerns, about risk, about medication side effects, and about other options. And then check. How can I reach you, the provider, after hours and on weekends? Write down what's said and what you and the provider agree to, otherwise you will forget. And then follow through with the decisions that you and the provider made and a way to report back. You as the family are the most important resource when it comes to the recovery of youth with serious mental illnesses. So I don't want you to think that you aren't an extremely important part of this whole business about responding to your child if they're struggling with a mental health crisis. You are really the ones that provide the day-to-day care, the emotional support, the advocacy while navigating a very complex system of care, made even more complex during the the crisis of the, given the COVID crisis. The families will need support of school, student services, of teachers during the crisis. So please feel free to contact them with any questions. They might be your first first call for help. If you're not sure, they can offer you some good information, some guidance, and certainly some support. Families provide that hope and belief their children will strive to reach their full potential, despite living with the challenges of a mental illness, especially during this COVID crisis. Finally, who to call for help. This is kind of a compilation of the things that Brian Johnson and I talked about. When there's immediate risk for that youth or others, call 911. They are going to be their quickest responders to restore safety and control. They're there as kind of your first line of emergency mental health response. If you need help, but there's no immediate risk, please call, whether it's a mental health or substance use provider or primary care provider. If you have no providers, contact your local crisis line or the National Lifeline or the crisis text line. The link you see is the Mount Horeb Area School District. That's what they have available when it comes to mental health guidance for families, and that is the website link for you to refer to. Brian Johnson, the Director of Student Services, has provided his email, and certainly the Student Services team members are all listed on their website. But he probably might be that first call for help. And the Mount Horeb Mental Health and Wellness Coalition is another invaluable resource in the Mount Horeb School District.
Thanks so much, Nancy. I really appreciate the practical solutions and information provided. This is one of two presentations that Nancy has done for us. The other one is also worth checking out, and that one really focuses on proactive strategies to help support mental health and wellness during this crisis, but really for any time of being or just on a day-to-day basis. So thanks again for the information and lots of resources for parents, students, community members to reach out to in any way that we can help. Please let us know. So thank you.